Hi, this is Laurie. I'm a PT. I'm just going to cover some things that I want everybody to understand about documentation. This is a PTA regular visit note, so I'm just going to run through it real quick. You want to click off patient identity confirmed. Your time in and time out, that's your actual patient time. It doesn't include note writing time or drive time. The date and mileage doesn't matter, so just leave that blank. Um, so this part should already be filled in, but there has to be the box that says homebound has to be checked yes, and some check marks following that. Vital signs, um, temperature, blood pressure, respiration, heart rate, and O2 sat is checked every visit. If anything's out of parameter, you need to call the doctor's office and let them know what was high or low, and then document that right here where it says comments. Subjective, quotation marks are always a good way to go, but please don't put the same thing every day. Alert and cooperative is not very good. Pain assessment, make sure you put where the pain is and what the pain level is. If not, click no pain reported. If there is pain, I haven't finished this note yet, obviously, but you do need to put what increases the pain, what relieves it, and what the pain interferes with, what functional activity. If you did not check strength and range of motion, which most assistants don't, and most evaluating therapists don't necessarily during just a routine visit, that's mainly a thing that happens at evaluations and reassessments. So don't just leave it there as if you checked all these things again. Check this little box that says not tested at this visit. Bed mobility, transfer training, all of these, if you didn't work on that intervention this visit, then all of this under training and intervention should be left blank. Same thing for gait training. If you didn't do it this visit, erase the whole thing. And then in these boxes that say impact of intervention on functional performance, that should show a progression towards meeting the goal. So you can't just put the same thing about how the patient has a horrible gait pattern and needs X amount of assistance and drags his left foot, and then he meets the goal for normal gait pattern. So every note should tell a story. It should show a progression of how his gait pattern improved over the course of the treatment. It can't just be the same thing every time. All these balance boxes should be checked appropriately. A lot of people just leave those blank. This isn't a training section, it's just stating a fact. The fall risk and functional testing, if you want, you can update any of these tests that were performed on the initial eval. Okay, this part here is a biggie, the exercises. There should be some sort of therapist intervention on most of your exercises. Either you needed to guide them as far as verbal or tactile cues for the technique they're using for that exercise, or you needed to provide contact guard assistance, or you needed to hold their foot down while they perform their straight leg raise. Whatever part you played, you need to include that because otherwise insurance is going to assume that the patient could get by with just a home exercise program and discharge the patient. So you need to show why your presence is important there at the visit. Impact of exercise on performance. Something should be put there. It shouldn't be just left blank. Assessment, teaching. This normally looks the same on every visit that I check, so it shouldn't. There should be comments stating exactly what you trained that person on that day. It shouldn't just be a standard statement that you use for every single visit. Progress to goals. So progress has to be documented in a functional manner. I'd prefer not to just see muscle strength improve from 4- to 4+. I would prefer to say patient is having an easier time standing up from a chair. Everything's about function these days, and all goals have to be related to a function. Everything we do, all of your treatments need to be related to a function. And every chance you get, you need to mention in your note how what you did relates to their functional abilities and the improvements that they're making. Continued PT needed for, that needs to be filled out. Progress delayed, that's optional. Summary, again, that should be as functional as possible. You need to be able to say, and ask the patient every day, if there's a particular skill that they have trouble with, say, how'd you do with taking your shower today, or whatever that skill is. And if the patient says that I was able to climb into the tub today without my daughter holding on to me, well, then state that here. That's progress towards a goal. Plan for next visit. It can't be continue plan of care. It can't be Therex. It can't be something vague like that. It has to be a particular thing that you want to work on. You want to work on a particular exercise for the purpose of improving ability for sit to stand, something like that. You're going to work on stepping into the tub independently using grab bars. Needs to be functional, and it needs to be specific. Conference with. This is automatically going to be filled in from the initial evaluation. So if it says Tammy was contacted regarding frequency and duration, then that needs to be erased. That's obviously not something you contacted Tammy about. But if you're a PTA and you spoke with the PT, that's what needs to be documented. If you're a PT and you spoke with your PTA, that needs to be documented. Call that person by name and state what you talked about. Assistants and evaluating therapists should be communicating on a weekly basis about every single patient. A phone call is required after the first evaluation to explain what the therapist expects from the assistant, and then weekly thereafter, an email, a phone call, or a text or something to discuss progress to goals. We do appreciate all of you guys. We know that documentation is getting extremely hairy and hard to do. It's just hard. It's never good enough. And you may think that we don't appreciate what you do, but we do appreciate y'all. And we're just trying to make our documentation and our therapists as good as they can be. Thanks for listening, guys.